And so when I started, I did all the things that I was trained to do. Guideline-based medications, which can be very helpful, procedures, which at times can be very helpful, and then maybe a Mediterranean-style diet. And patients got a little bit better, but not a heck of a lot better. And after a while, I was kind of getting disillusioned. I'm like, what am I doing? I didn't go into medicine to help people get just a little bit better. I really wanted to find a way for a transformational change. So I've been, a cardiologist now for about 13 years. And outside of, emergency surgery, like someone gets shot and they have to be put back together again. So outside of an extreme example like that, I've never seen anything come close to the breadth and depth of benefits that a plant-based diet provides. If you can make a clogged sink analogy, where you turn water on in a sink, and if you stop up the drain, the water will go up, and eventually it will spill over. And one of the things we do in medicine now is we're really good at mopping up the spilling water, but we're not really getting to the underlying core of the issues. And in many cases, perhaps even most cases, it's lifestyle, how you're eating. Say, why is it that a plant-based diet per se may be the optimal way to unclog that drain? There's a lot of different types of evidence to support that, from very, very large population studies of hundreds of thousands of people looking at, and we'll talk about some of them, but supporting a plant-based diet. There are test tube studies looking at very specific mechanisms as to why that may be the case. There are randomized trials where you randomly put people into two different groups that support a plant-based diet. So there's a whole panoply of evidence.
It's pretty endemic in the West, cardiovascular disease.
Yeah, I mean, it is the most common reason for adult men and adult women to die. Women are about 6 to 7 times more likely to die from heart disease than they are from breast cancer. And there are about 2 heart attacks every minute in the US. And a heart attack, of course, is when part of the heart muscle dies from a cholesterol blockage, from lack of blood flow. And so, in your 20-minute commute to work, that's 40 heart attacks have happened on your way to work, and 40 heart attacks have happened on your 20-minute commute home. There are pathology studies of 12 to 14-year-old kids in the US who died for reasons unrelated to heart disease, but about 65% of those 12 to 14-year-olds have early signs of cholesterol disease in the blood vessels that feed their hearts with blood. As Dr. Esselstyn has put it, when you graduate from high school, you get your diploma, but you also get heart disease in the Western world. Basically, across these populations, the less animal products you had, the less disease. The more animal products, the more disease.
If they were willing to do whatever it takes from a diet perspective, what's your specific advice?
So my specific advice would be to eat a whole food, plant-based diet. If it has a face or comes from something with a face, don't eat it.